Good afternoon, everyone. Welcome to the Poverty and Homelessness Board Executive Committee meeting. We are going to just get started because there's a lot on the agenda today. We're going to dispense with the approval of the minutes at this point until we have a quorum. And so I think the first thing we need to talk about is the continuum of care grant scores. And I think Amanda Borda is on task for that to give us a debrief. Amanda?
I'm here. Can we hear me?
Yes.
Yes.
And Alex, do you have it to pull up on the screen, or am I able to pull it up on the screen?
I just sent you a request to make you the presenter.
Oh, okay. Okay, so I think you all are seeing it now.
Yes.
Okay. So this should be fairly brief. We received our scoring from the previous competition, the fiscal year 19 competition from last year. And I'm just going to quickly go through kind of a high-level overview of our scores, and feel free to ask questions as I go, or at the end if you'd like to wait. So just to go through here, we have they did the scoring slightly different this year, but overall, they don't give us a ton of detail on the scoring. It's really high level and by section, not necessarily per question. So for some, we won't know exactly what we scored well on or what we did not, but we'll know per sort of section area what we scored on. So for this first one, we have the Continuum of Care Project Review, Ranking, and Selection. So really what that's looking at is our ranking process, how we evaluate our projects based on performance. So that's our evaluation process, which is underway currently for this year, and things like that. So it asks us about all of those processes in that section. We scored fairly well with 17 out of 18 points scored there. Moving on then to the second page here. I'm just going to remove this out of my screen so I can see what I'm looking at. So moving on to the second page here, we scored well in some of these areas as well. Homeless Management Information System bed coverage rate. This essentially looks at our participating beds and projects in HMIS. And so if we're above a certain percentage threshold there, we receive 6 out of 6 points there. System performance is the next section. This is really the bulk of the points of the application and where most of our scoring comes into play. This really heavily relies on, one, our system performance measures that we submit to HUD each year, as well as sort of our huge narrative sections of what we're doing then to improve those system performance measures. So the first one is this first-time homeless, a smaller amount of points for that. So that looks at who's homeless for the first time within our system and what that number is. Then we have length of time homeless, 3A2 here. This is one of the areas where I think we certainly have room for improvement. We scored 8 out of 14 points for this section. So this looks at obviously length of time and reducing the average length of time that individuals are experiencing homelessness. So how quickly, essentially, from the time someone becomes homeless to the time that they're becoming housed through our system. And so we've added several strategies there throughout our continuum in the last couple of years, but I think we still have some work that we could do there as far as strategy. The next one is permanent housing placement and retention. So just like it sounds, the individuals and families that we are able to retain their housing and are able to exit permanent housing. We scored fairly well there with 9.5 out of 11. The next measure is returns to homelessness. So out of those folks that have exited to permanent housing, how many people have returned within a certain period of time? So this looks at over a 12-month period here in this question. And what our strategies are to sort of prevent folks from returning back to our system. We scored 3 out of 8 points there. So I think there's also room for improvement with this measure as well in terms of how we really capture people once they exit during follow-up, and how we prevent them from returning back to homelessness as much as possible. The next one is jobs and income growth. We scored 8 out of 15 points here. This one did have significant changes in the fiscal year 19 competition. I think we scored probably well as far as some of our strategies, but it did have several new checkbox questions that we had to answer that seem to be added through this current administration. So previously, the emphasis was really on permanent housing and making sure folks are getting housed and increasing their income whenever possible. This really focused more on increasing employment, which we know is part of our strategies, but certainly there are a lot of folks that we're serving that are in a really high need population who have one or multiple disabilities, and that's really been our priority population. And so a lot of those folks are on Social Security or fixed income and aren't necessarily looking towards employment goals. So there's a little bit of a disconnect there in terms of priorities locally versus by this administration. The next few sections, so this is just based on our system performance submission. So we received points for doing that. Moving on to these, we actually scored fairly well in the accessing mainstream benefits and additional policies. So this looks at several different things as far as projects that are housing first, looks at street outreach, and then our rapid rehousing inventory, which we were able to score points on this year. So just as a quick overview of all of that, these are the sections that they provided scores for. Obviously, there are a couple of sections. I think system performance is the majority of our points, and we were not able to score highly on a couple of those metrics. And so I think there's some strategy that we need to really invest in there, as well as our performance and strategic planning, which is similar to that section as well. So really, the emphasis is on improving our system performance measures, and that's obviously where the bulk of our score is going to be. So just to summarize, the highest score for any COC is 186.5, the lowest is 37.25, and the median is 150. So we scored just below the median score there this year at 146. Are there questions that folks have about any of that?
Anybody have a question?
Oops, sorry.
Yeah, we can hear you, Lucy. Mayor Vanessa.
Yeah, so sorry, I managed to take myself out of the system. So I'm sorry that I stepped in a little bit late, and you may have said this in the beginning, and I may have been a little bit distracted, but looking at the overall score and your summary of comments that the issues is low system performance and strategic planning are the two things. I'm assuming we're connecting the dots there in terms of our TAC report and how we're looking at our system performance, and those two things correlate. And I don't know if there's anything specifically you want to say about that,
Sure.
where our systems are weak, and that's reflected in the TAC report and reflected in our strategies going forward.
Mm-hmm. Yeah, so the recommendations for our system through the TAC report certainly would impact a lot of those system performance measures. For example, if we're looking at length of time homeless, folks are staying homeless longer because we don't have the inventory right for folks to move through our system and the appropriate inventory. And so folks are staying unsheltered longer, they're staying in shelter longer. And so increasing our permanent supportive housing units would impact that measure as we are able to move people into units, as well as our moving on voucher goals. And so moving people out of permanent supportive housing to other subsidies would help with the flow. So all of those TAC recommendations that would increase our flow through our system, the coordinated entry recommendations as well, would impact that measure in particular because we'd have more flow through our system and folks would be able to be housed much more quickly. Same goes for our rapid rehousing strategies. If we're able to increase that inventory, we'd be hopefully able to get folks into housing quicker. So does that help kind of connect?
Yeah, I just make sure we're connecting the dots for anyone who's watching this, that the TAC implementation will have a direct impact on this report, presumably.
Yes,
and this
so
is a
if we are able
2019.
to implement those, it would hopefully implement. And these really look at the year back, so we wouldn't see those kind of impacts for a little bit of time. So that's good to keep in mind as well.
Amanda, this is Noreen. Can you just, this is July 1, 2019, or is it July 1, 2018 through June 30, 2019? Or is it a calendar year report?
So this would be based on our the information we submitted in the last competition, but the system performance measures would have been based on the HUD year. So they look at October to October. And I believe that would have been, I'm trying to think back, and maybe Lisa can correct me if I'm wrong. This might have been 2017 to 2018 year. I have to
really
go back and check.
Prior to the TAC assessment. And yeah, but I think it's a really fine point, Lucy, because I think it just points to all the challenges we know we've had, and we've already started to implement some of the solutions. We've taken steps in that. And I think COVID-19 has also jettisoned us into some other, to maybe some faster action in terms of thinking about how to house our folks who are unhoused. Any other questions for Amanda? Pat, Commissioner Farr?
Thank you. Can you go back to the final screen, the one just that you showed just before this one?
Sure.
The one that had all of the that one right there. Yeah. So I'm looking at our score versus the maximum score, and there are some that we're doing quite well on, of course. I mean, this is just a topic for ongoing discussion. Performance and strategic planning, we have 50% of the possible number of points. And I guess to me, that's an area of opportunity for us, because we're pretty good at strategic planning, and we're pretty good at tactics surrounding strategic planning. So I think we need to have a longer discussion about how do we, why do they feel that we're not using a strategic plan to develop the to maximize the outcomes that we've identified as our goals. I don't need an answer to that right now, but that's a topic for ongoing discussion as we move forward, as well as system performance, which we all know where we are addressing system performance, but we're looking at about 50% of the maximum number of points there also. So any comments on that? I don't think it's a matter for a deep discussion at this point in time, but it's something that is flagged to me. Am I missing something there, maybe, Amanda?
Well,
Amanda, are you
this
gonna
is, Lisa, and the system performance, we really, I mean, honestly, we have kind of poor system performance. We have a lot of returns to homelessness. We have a lot of unsheltered homeless people in our community. And those are part of how the system is assessed for health.
Thanks, Lisa. So we're actually seeing an accurate portrayal of our actual performance, which means that we have a great deal of opportunity. And if we're short, then there's ground to gain. And I hope that we have enough resources and enough talent in this community to address the needs there and make it happen.
Well,
yeah, I'll just say
thanks,
a lot
Lisa.
of this is based on the straight numbers, like Lisa was mentioning. So it's just based on the data that we submit, and if our numbers are not going in the right direction, we automatically will not score on those points. And then the other piece is really the narrative that we use, and we did talk a lot about our tax strategies in the last application, but like I mentioned, some of that does take some time. These are big system changes, so they're not things that happen overnight, but really things that we need to gradually see improvement on over the next couple of years once we start really implementing these strategies, and really be monitoring regularly our system performance so that we see if things are having the right impact or if they're not, and so we're able to shift quickly. So Lisa's been doing a lot of work with Tableau and making sure we're able to really dive in a little bit better and visualize our data so that we're able to look at it more frequently with a closer eye and really have an eye on what's working and what's not. I think you'll see more.
Thank you for that, Amanda. And
yeah,
I do think
interestingly,
excuse me. I was just going to
mention that both of those areas mention the word performance, system performance, and performance is strategic planning. So interestingly, that I think we know how to perform. And Lisa, you're pointing out the fact that we've not performed. Let's see, your words are we have poor system performance. I think knowing that it should become a highlight for all of us for what our future plans are. So It's
Mhm.
it's good news to see. Thank you.
Yeah.
Noreen, I have a
think it's-
question.
Sure, please do, please do.
So Amanda, or Lisa, the number 5 performance, that's the performance of the specific projects that we have funded with the HUD funding, as opposed to the overall homeless system that we have in the community.
These numbers would look at our full system, whether they're COC funded or not.
But both number 2 and number 5?
Yes. So our
Okay.
system performance measures review, and our HUD grant really reviews all of our system and how it's performing versus just COC projects.
So number 5 is also a reflection of the system performance then.
Yeah. That's what it,
Because I agree with Pat that we probably do well with strategic planning if we look at subcategories, but probably again it's performance. And one of the areas that has been with a number of our existing projects is that HUD switched a few years ago and moved towards us taking folks that are more chronically homeless and implementing the SPDAT type scoring that gets the folks that have the greatest chronic illnesses and other kinds of conditions such as mental illness. And so I think it's also a reflection of we have a way to go to provide services to support the people who we've housed.
Steve, I think that's really great context to have, and I would agree with Commissioner Farr that really, we have a lot of opportunity, right? And I think this is sort of, it sounds like to me from the timing that it's pre-TAC, assessment and implementation. So I think if we were sort of fast forward this, we would see that we've made some progress, and maybe those scores would be actually better. But we all know we have a lot of work to do in our community. So I'm going to move us along because I'm conscious of time. I do think, do we have a quorum now, Alex?
Yes, we have quorum now with
Okay.
4 members, including Chris McAllister, whose webcam you can't see. Okay.
So I'm just going to back up if I could. And by the way, I didn't introduce myself. I am not Pat Welch. I am Noreen Donald. Sorry, I'm standing in for him at the last minute. He had a meeting to attend today. I'd like to back up to the minutes from the January meeting, which seems like a lifetime ago, and see if people could take a minute, review those minutes if they haven't already. And I entertain a motion to accept or approve the minutes.
So moved.
That was Chris
Second, Farr.
and Commissioner Farr. All those in favor, please indicate by aye.
Aye.
And anybody opposed, signify by nay. Okay. Thank you for that. It's a perfunctory item, but we had to get through it. So thank you for that. I appreciate it. So next we're going to move into the point in time count, and Melissa Coloma, I think that's, hopefully I didn't butcher your name, is going to give us a little bit of a preview, and then we're going to move on to a couple of other presenters on the point in time detail. Thank you. Melissa?
Okay. Are you guys able to see my screen?
Mm-hmm. Yes.
Yes.
All right. So these are, oh goodness, the numbers for this year's point in time. This year's point in time, we did slightly different. Instead of doing surveys by paper, we did the street count by a mobile app. So everybody had to do it electronically. So this year, the numbers are a little bit different than last year's, but they are consistent with the years prior to. Unsheltered was down a bit. I don't know how to move this away. I have this thing that is right over the numbers, so I can't see what the numbers are. So, unsheltered numbers are down. Emergency shelter and transitional up just a tad, and then the total number down a little bit from last year. The chronic homelessness this year down with 554. Veterans number at 167. Substance abuse at 277, and then mental illness at 467. Household types for youth households, it looks like there was a total of 20. Households with a child, so family, at 72. And then total with just single individuals at 1342. So those were the numbers for the actual point in time. And then Lisa's gonna show the information in regards to the HIC. And then I think Dana's gonna show you our numbers from the by name list.
I'm gonna show from both, so we're good.
Okay. Okay. So, Alex, I think you can transfer it over to Lisa now.
I believe we're looking at Lisa's screen, and I just want to add that the full report is forthcoming. This is the preliminary general numbers that we have to report to HUD. But we'll have a more in-depth report that looks at the population by city, things like that.
So can you folks see my screen here?
Mm-hmm. Yes.
All right, so
Small.
I'm just gonna, there we go. So the housing inventory for the night of the count, which was January 29th, it didn't really change significantly from last year because we haven't added any new housing inventory from prior years. So we're in the emergency shelter, we have around 500 beds. That would be right here. And I don't know if Alex sent these documents out to you all already, but they're available in draft form like this. Transitional housing remains 127. Rapid rehousing this year was 194. And permanent supportive housing is 688 beds. But I just want to point out that we are still struggling with utilization on our permanent supportive housing. It's still sitting at 81% utilized. And there's two reasons for that. One is they often have beds that they have not requested a referral from the central wait list. And there's also beds for which somebody is enrolled in the project but has not found housing yet. And that remains challenging to folks who are in permanent house and rapid rehousing, that they might be program eligible, that does not make them landlord eligible. So it continues to be a challenge in the community for that. But I'm really more interested in showing you the flip side to the point in time count. The point in time count was significantly lower for the unsheltered folks, specifically unsheltered adults. And it kind of raises an alarm that it would be that much different. Just want to remind you, the unsheltered count are people who agreed to a survey that day. It is like the worst possible way you could gather information and make some decisions on it. So we know that, and that's why we now have a homeless by name list, which is on much more solid footing. It resonates with the providers and the homeless advocates as being more true to the community experience of homelessness And also we can look at it at any time and understand in this month, last month, or even January 29th on the point in time count, we can understand what the homelessness count, or what that need is in our community. And I'm really hoping to redirect us away from that point in time count, even though we still have to do it, we still have to collect it, to our better numbers about who is actually experiencing homelessness in our community. We also are able to look at emergency shelter and all of our housing every month and understand really what's happening on the ground now, what's not being filled, what remains without a move-in date, who's actually in a project, how are we really using all of our inventory for transitional housing. But this is out there, and we did get approval from the HMIS subcommittee to publish this information out publicly using a Tableau to the public, so people can do the analysis of these month by month. I feel like if we put this information out there, we have a lot of problem solvers in our community that might be able to look at this information and help us come up with new solutions that just, and when we're on the ground in the middle of it, aren't seeing. So I'm really excited about having these data out there. One thing that we do want to do is we want to have our H&HS leadership approve it before we publish it. That's one of our last steps before we get that out there. But
Commissioner Farr, did you have a question?
Yeah.
So just
thank you. I didn't really, Noreen. I can wait until the end of Lisa's presentation. If it's over, I have a quick question.
This is kind of the end, Pat. Go ahead.
Well, Lisa, it's no secret to people who kind of watch me work that I write down quotes, and I wrote one of yours down that I'm going to carry around with me. This is the absolute worst way you can conduct a count, and I quote. And that's why we have a homeless by name list, so we can look at any time. To me, that is a part of our future, is understanding that the point in time count is a pretty inaccurate way for us to actually conduct our business internally, and understanding that we do have to report it and we do have to do it, that really we have better ways to identify where people are homeless, why they're homeless, and how we can deliver them from homelessness. So to me,
absolutely. And I do want to say that the way that we conduct our unsheltered count is actually good, but there's so many variables on whether or not somebody's going to want to have an interview with us, whether we find people, because people move around during the day. It is just not going to provide us accurate numbers, which is why we get sometimes these wild fluctuations that we can't explain. Mm-hmm. It's just because on that particular day, the dynamics of trying to find folks and identifying people who've experienced homelessness in our community are super challenging.
So Lisa, can you grade me on my next statement? And it's a very short one. While we have to conduct the HUD homeless point in time counts, that is not what we need to use to analyze the data that we generate locally. We have far more accurate data that we generate locally that we can use on an ongoing basis. Thank you. Okay.
Mayor Venus, you also had a question.
Yes, thank you. Lisa, could you just scroll that screen up a little bit so that we can see the bar graph at the bottom as well? Ah, there we go. Okay, so that's
I'm wondering about this one.
Yeah.
So that's a data anomaly where Dana Davison is the genius behind the Tableau, by the way. I provide data, but she provides this beautiful visualization. Dana and I are still trying to figure out why this number is so low. We thought it was perhaps because it was the end of a year and then people didn't get included, but that isn't the case. It really is that in May and June, less people sought services at the provider agencies. Therefore, less people were active and not counted. It really just was low. So we're looking to this summer. Well, this summer is probably not going to be a good comparison, but we'll look to next summer, hopefully when we have a new normal, and see if we're seeing the same kind of trends that people just don't receive as many services in the spring.
Well, so I have two questions, which I think we won't be able to answer probably until next year. But so we are down April 2019 to April 2020, we're down. And so that's people seeking services. And presumably that's been impacted by the fact that we rolled out an emergency response for COVID and people moved into sites. We had outreach teams. I mean, it doesn't make sense.
It's mostly because people didn't seek services.
No, I know, that's what I'm saying is
Yeah.
the conjecture would be they didn't seek services because we actually had them available at the fairgrounds and we had outreach teams. And so one of the factors that I think we're going to be interested in is how effective are those outreach teams? So it will show differently on these people seeking services if in fact we have outreach teams going out to meet them where they are. They're not going to come in to the providers.
We don't collect the outreach is not using HMIS.
Right.
So anybody who received a service from that program is not on here unless they received a service at another agency.
So that I'm just pointing that out, that, and Chris may have a comment about this too, that would be a data point that we're actually going to really want.
Yes.
Yeah.
Otherwise, you don't have that. You're not, the comparison doesn't.
You're not going to compare. It's not going to make sense anymore.
Mm-hmm.
Yeah.
Chris, do you have a thought on that?
I do appreciate this data point. One thing as a provider I've noticed is while we may have been able to do more basic needs, helping with access to toileting, helping to access to food and some shelter, I found that it was a lot harder to schedule medical appointments, a lot harder to continue on mental health and behavioral health treatments, and get people who were on the waiting list and who were at just the next step. People were starting to tour places to rent, and then they were told that all this stuff had to be walked back or they couldn't do that. We also saw a lot of people were displaced at the beginning when we sought to have hotels utilized for the COVID positive folks. So a lot of unhoused people who are currently sheltered in the hotels were pushed out by both closing hotels and people who were afraid that the homeless that we did put in there were COVID positive, which was not the case, but it shut down over 600 beds that we normally have access to for temporary shelter.
Wow.
600 beds?
That's two giant hotels closing down where we do most of our low income groups. Only 2 hotels in all of Lane County were able to help us place people. And we were only able to have 5 beds in 4 weeks.
Commissioner
May I ask
Farr?
a question of Chris?
Yeah, please.
Chris, thank you very much, Chair. You use the number 600, and the number we talk about that have been, we use the number 300 when we talk about the regular shelters that have been diminished in size by 300. So the 300 extra that you're talking about have been turned out of hotels. Is that what I hear you saying?
Well, I was just saying in terms of possible beds and our capacity, because when they say, well, we have so many hotels available for vouchers, for placement, for temporary measures, that was what I was placing at. Because when Hotel 6 went down, they took a whole lot of hotel rooms off the market. When Regency said no, that took a whole bunch of beds off the market.
Okay.
And
Thank you, Chris,
Chris,
for that
you're talking about people who, some people who typically will do the week to week rental of the motel rooms as a housing strategy.
There's that, as well as people who've been put in place by like First Place or domestic violence supports, people who've been put in for medical recuperation, but not quite able to get into the Trillium site. We put a gentleman there who came to our shelter, and we were just simply not able to accommodate. We were ADA capacity, but we are not fine-tuned enough for his individual needs. And so it was a lot easier to put him by himself in a hotel than it was to have staff trying to accommodate in a dormitory type setting.
It's interesting because we took a different strategy here than they did in Salem and Marion County, and they were actually able to increase their hotel motel beds by 100, getting 100 people who were who had chronic health conditions and were homeless into hotel rooms. So I think that's an area where we have something to learn. I'm not really the person to go through this. I know Sarai is probably on the call, and Pat knows some of the background on this, but some of the success in some other communities was on the front end, the way that they approached the lodging community, and then some of it was just based on in some communities where who the tenant was going to be was tenant blind. In other words, there wasn't a governmental entity or a nonprofit who said, well, this is part of a COVID-19 project and we would like to house somebody there. It was just, this is somebody who is a citizen of Oregon who has a resource to rent a motel room and would like to rent a motel.
Yeah, point well taken, and lessons learned, right? Lisa, did you have another part of your presentation? Is Dana going to speak? I know we need to approve this.
That was just, it was just, I wanted to keep redirecting folks to the by name list for their numbers when they're using that. And then between Melissa's pit count data and this housing inventory chart, those are the things that would need, those two documents need to be approved by this group for us to submit to HUD Exchange.
Okay. Yeah, Commissioner Farr.
Thank you, Chair. And before we go to that approval, back to your comments, Steve, regarding Marion County and the way they approached it versus the way we approached it. We all know there was a tremendous hue and cry once the general public believed that the county was going to mandate use of hotel rooms. And I believe that kind of an action that we took really raised flags that really didn't need to be raised. And we may be looking at Marion County to see more how they did it in a more gentle way that didn't make people mistakenly believe that we were going to be forcing them to use their property to do government work. I mean, quartering is what caused the American Revolution, I think.
Okay. Thanks for that commentary. Any other questions for Lisa or Melissa? Okay, I'd entertain a motion to approve the two documents that are listed here, the pit time and then they're the HUD documents basically, right?
Right, the point in time count and the housing inventory chart.
Yes, thank you.
I move that we approve the house, whatever we just call the point in time chart and the housing inventory report.
Thank you.
I'll second that.
Okay.
Thank you.
All in favor signify by aye.
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 Thumbs up. Any opposed? Okay, I think that we've passed. We've approved those two documents, and thank you so much, Lisa and Melissa, for sharing that information. I do think I really appreciate the Homeless by Name ability to capture that information, because it gives us so much better data to really think about what are the best strategies for finding the right kind of housing for people. So thank you so much for that. All right, we are moving along on our agenda. The next part of the agenda is the COVID-19 recovery plan. And Steve, you're on deck for that. I know there's a lot of elements to this because we had a conversation about this last week. So I'm going to let you share it, and then there may be some questions. So we may stop intermittent.
And I wanted to find out, is Sarai on the line? Are you on the line, Sarai?
I am. Can you hear me?
Yes.
Oh, great.
Great. I'm going to ask you to fill in areas that I'm deficient, because you've been involved with the EOC throughout. But we are moving into a recovery phase you know, in following the governor's outline for reopening. And the recovery phase includes both, you know, housing, which Sarai is taking a lead on, social services and healthcare that I'm working on, as well as economic development and economic opportunity, such as employment and training. So there isn't a filled out plan per se, but we are just starting to pivot towards recovery plans. And I know the city of Eugene and city of Springfield are doing similarly. I'm going to go through some of the resources that are available to us. But before I do that, I sort of want Sarai to sort of give a situational report about where we are with the respite shelters and sort of what the timeline is for standing those down, and what kind of strategies are being used to see that people get housing and care.
Sure. So as you all know, we have 2 emergency respite shelters, one at the Expo Hall in Eugene at the Fairgrounds, and the other one is in Springfield, the Memorial Building. The Expo Hall has already started to reduce census through attrition starting on May 12th. So they have currently about 80 people there, and our maximum capacity was 140. So we've already kind of stepped that down a bit, largely because of St. Vinny's need to redistribute their staff back out to stores and other things as those things begin to reopen in phase 1. So that's happening there. In Springfield, they're not intentionally reducing census at this time, although there are fewer people staying. And Chris has more information, but last time I talked to him, he was saying that people have concerns about what happens next, which makes a lot of sense, because on that front, we have currently lost about 250 of our regular shelter beds between dusk to dawn and the emergency and the Eugene mission. So we are down shelter beds, and the respite shelters approximated, counting Eugene's designated temporary shelter sites, the tents that they served about 30 people there. We served about 170. So between us, we were able to pick up about 200 of those beds for the period of time between March and now. Where we're at June 5th, when these shelters demobilized, is still really working hard on trying to find out where are people allowed to sleep, what are safe spaces for people to sleep in, both through potentially relocating the DTSS, the designated temporary shelter sites that Eugene has stood up at their community centers, to a different location to be determined, as well as to probably expand access to maybe creating more of those, and a couple of other ideas on the table that the city of Eugene and the county are considering, and that Springfield's also engaged in the conversation on siting, potentially for tent sites, potentially for Conestogas, potentially for who knows what. We're kind of
Right.
Yes.
Excuse me, just one second. I don't know, we're getting a lot of background noise, and I'm not sure if people.
Oh, I'm so sorry. It's because I'm in the EOC.
Oh, okay, okay.
I'll
I was
move.
just thinking there's a lot of noise, and I wanted to make sure we could hear you clearly. Okay,
There's
thank you.
a conversation by me, and I have noise canceling headphones, so I'm like oblivious. Is this better?
Yes.
Cool. So yeah, we ultimately we're just looking at what are all of the options and trying to bring those forward. And my daily job is to constantly nag, beg, plead, force, try to get something like that online before we fully demobilize, because otherwise people do not have a safe place to sleep at night. And we know that that's going to be really critical as we move into the summer, recognizing that COVID-19 isn't going to go away and we'll likely have another bump in the fall. So we would really like to make sure that people stay safe through the summer as well. And that's my semi-depressing update.
Before I go on, does anyone have questions for Sarai on that piece?
I do. I'm curious, Sarai, what is sort of the end date for the fairgrounds? Is there an end date in mind or being considered?
Yeah, June 5th is the end date. That would be the date that, if everything aligns with the phasing the soonest that we could enter into phase 2. And so the rationale behind that is both that FEMA funding is running out or kind of ending for the congregate shelters at that time. And we also expect that some resources in the community will be available again to replace the things that we were able to stand up at the respite shelters, which partly was, of course, for housing/shelter for a moment, but more importantly, access to basic needs that were no longer available in the community.
Thank you.
So what I would add to that, I think Sarai touched on it, is that, and Lisa, if you're on the line, our bed census at the Eugene Mission and at Dusk to Dawn is down. And at one point it was down about the same amount as the number of beds that we created with the respite shelters.
That's correct.
Because
so
of
we basically swapped.
need.
We didn't add any new capacity.
But and we've heard along the way from Cheryl, the executive director at the Eugene Mission, that they may plan on continuing. They're planning on continuing to operate with the census that they have, and then currently we have that in terms of our public health approval, 125 beds at Dusk to Dawn, and give or take, but and there have been some discussion. We currently have staff from the city of Eugene and Lane County have been in conversations because there was some interest in trying to increase beds at Dusk to Dawn, but currently our public health officials are saying that they would recommend that that doesn't occur, even with some of the tactics that they're using in some other communities, you know, such as putting dividers or, you know, these plastic pieces between beds to get more beds in. So I just wanted to mention that because we are, you know, we will be down a couple hundred beds, you know, from what our pre-COVID capacity was. So I'll move on, and then Sarai, do you want to touch on, while we're talking about things that have come out of the EOC, what's happening with the River Avenue site? What the status?
Sure.
Yeah.
Yeah.
May I ask
absolutely.
a question really quickly before you move on with that? And that is, it's not a question, it's just a flag. We have June 5th as the approximate date that we're going to completely close down, or that's the date, approximate date that we're going to close down the temporary shelters. And we've been talking about what happens on June 6th. Now, I don't expect a robust discussion right now, but we have to be aware that when the temporary shelters at the fairgrounds and at the other places like the Memorial Building shut down, we have a potential crisis on our hand if people don't have a place to go. Even Sarai, though we know that we've reduced the numbers already from the maximum that we're staying there, I know that we have some discussion underway between the city and the county as to what is going to happen. But I think I'm excited, not excited, but I'm anxious to hear the agreement between the city and the county as to what it is that we are going to do on June 6th. So that's a topic of discussion that I bring up at the Board of County Commissioners quite often.
Mm-hmm.
If I could just jump in for quickly, just adding to that, I'm assuming that the folks that are camping with their own tents that are on the county fairgrounds will also be required to leave those campsites on June 5th, or is that a separate conversation?
I believe that's the plan at this time, though I'm not sure that the fairgrounds as a possible place for camping is completely ruled out
Okay.
at this point. Yeah.
Okay, thank you.
And I'll just add one thing that I know about that, Mayor Venice, is that the city of Eugene has been kind of turning a blind eye to unsanctioned camping in public places, such as outside of the fairgrounds along 13th Avenue. And I'm expecting that the city of Eugene is going to become a little bit more strict about where they allow unsanctioned camping.
Well, I just have to say, observationally, I drove past it today, and there were no campsites along the fence on the outside today. So I don't. My impression was they'd actually moved inside the fairgrounds. That they're not outside; they're inside now. But I don't know that for sure.
Soraya,
Yes, they did.
Yeah.
Sorry, yes, they did move inside the fairgrounds for that particular group of people. And then I think they posted like no camping and are enforcing outside now along the fairgrounds, outside of the fence.
And
But
there's
it
a
is
rather
true.
large group underneath the Washington Jefferson Street Bridge that I would presume EPD is going to be moving at some point.
It's
Not that I'm
possible.
in favor of that.
Well, CDC guidelines.
You cut out.
Can't hear you, Sarai.
Can you hear me now?
Yeah, yes, we can.
Okay.
Yeah.
Okay, great. So the CDC guidelines haven't changed. They were most recently updated on May 10th to suggest leaving encampments in place as much as possible is still the preference. And so patients, our emergency manager at the county EOC and I are going to be talking with Chiefs Heppel and Skinner later today a little bit more about enforcement and what that can look like. And we have a couple of different proposals, one in particular on the table for trying to figure out if there's a way for us to manage independent camps a little bit better through like a temporary hardship permit concept or something like that. So we're kind of floating these different ideas and seeing what might come of it. Not totally sure what the appetite or comfort level is with doing something like that, but we need to find a way to allow enforcement to come back online over time without, again, not having any place for people to go. So I think we need to kind of figure out what the balance is.
One thing to also consider, I'm in Springfield and our police never stopped enforcing the prohibited camping ordinances due to COVID. They continued to drop people off at our shelter as well as encourage people to come even when we were full, which led to camps starting to pop up downtown. A lot of the unhoused sit there and they see the CDC recommendations and they know that the options that have been offered to them are not in recommendation of the CDC policies. So it makes it a little bit harder to sort out when we don't even have the options that would be recommended by the CDC in place. The unhoused want to know where they're going to go, and it's even worse now that they have a deadline but no options. Every day we had over 15 people leave in the last 2 weeks because they don't know where they're going to go. And so then we replace those beds immediately, and then people were like, well, where are we going to go now? And so they hear that the fairgrounds is shutting down. They hear that the Wheeler Pavilion's shutting down. They hear that the River Avenue is opening up, but they don't see where they fit into that. And we're not even talking about Oak Ridge or Veneta or I yield.
Yeah, thank you, Chris. That's definitely, since I live out in Veneta, and I know there's a group of folks that I see wandering around now, and I don't know what there was for provisions for some of the rural communities, but definitely a challenge. So thank you. So Steve, do you want to continue to provide us with?
Yeah, I'm going to run through now the COVID-19 recovering funding information that's on your screen. And Alex is helping me guide through this, but I'll just go through the list and then I'll ask on the community development block grant if Stephanie Jennings or Aaron Fifield would like to speak to that one. But we received an allocation of close to $930,000 from the state of Oregon for rent relief. And we're currently in the process of, staff have been working on putting together what will be an online application. And the plan is that we're going to contract out a good share of that money to community service centers such as Catholic Community Services, Community Sharing, Cellular Outreach Services, and they will help us with doing the eligibility assessment after people are pre-screened. Another portion of the funding is being held to work specifically with the non-English speaking Spanish only population, and a partnership with Central Latino and some of their partners to work in providing rent relief to populations that have not been eligible for stimulus payments or unemployment or some of the other resources that have been available during the pandemic. And so that will be an element of the overall program. Additionally, one of the goals of this is to serve people who have medical conditions where they otherwise would, if they became homeless, they would be at higher risk of contracting COVID-19. And so we plan on working with the groups like the Community Health Centers of Lane County and Whitebird and Occupy Medical, to identify folks as a part of that population. So to sort of summarize, we have a general kind of first come, first serve approach through community service centers, and with the ability for people to do that virtually. We'll also have, for people who are disabled or need to do stuff by phone, we'll have the ability to mail information. We'll have the ability for some people to do things, over the phone. For this and for some of the other resources that we have, what our strategy is at the county is that we have a COVID-19 page, and as part of the COVID-19 page, we're moving to a COVID-19 recovery webpage. And so people will be able to navigate off of the county website to COVID-19 recovery, and then they'll be able to access things like the rent assistance application. And later on, I'll mention there will be some of these other resources as we open up programs. They'll be put on that page so that people can get information. A little side story is that the state of Oregon, in their press release, published numbers, and fortunately they didn't publish my number, but they published Diana Aldridge's number. And some of my peers across the state, they published their desk phones as the executive directors, and that was, so we're trying to do this in a way that will be user friendly and try to eliminate as much frustration. The other thing that I need to say about this, though, is that as we start in putting in additional rent assistance resources, the amounts of money that we're getting, even though it sounds like close to $1 million would be a lot of money, it's a drop in the bucket compared to the need. And so that's why doing some good screening and doing some targeting, you see on the screen here that people who will be eligible will be 50% or below of AMI. And You know, so Chris, you had a question?
Yes, sir. Would any of these funds, thank you, would any of these funds be able to use spots like at Armitage or something like that, that would be helping some of those medically fragile, like what we did with people after Camp 99? The reason why I'm asking is we're opening it up for the
I can't
public.
answer you right now, but I would defer that question to my staff, and we just got a draft manual from the state, and so I would need to defer to them, but we'll get your question answered, Chris.
Thank you.
So, Lucy?
Just sort of a comment or a clarification on the CDBG funds. I don't know if you're going to talk about that.
That's going to be next, and I was hoping that the that maybe Stephanie or Aaron or both could speak to those.
Yeah, I know Stephanie's on the call. I'm not sure if I see
Sure.
Aaron.
Can you
Yeah.
guys hear me?
Yes,
Mhm.
thank you.
Yes.
Okay, here, let me turn on my camera too so you can see me as well. Hi there.
Hi, Stephanie.
So I can speak a little bit to where we are in the process. I do just want to back up for a moment. So the city's use, both Eugene and Springfield's use of CDBG funds is guided by the 5-year consolidated plan. And we have been going through the development of that process and actually submitted it to HUD on Friday. So that was a very important step in terms of assessing the community needs and establishing priority areas. We were at the very tail end of the process, in which looks at lots of data, community input, but we were able to hold 3 public hearings in April, which were really kind of the final steps in the process, and to look at emerging data related to COVID and incorporate those emerging needs into the priority needs that are identified in the plan, which is a really good thing, and then also into the strategies. And so the overall focus for the consolidated plan for the strategies are basically fall into 4 areas: affordable housing, human services, economic prosperity, and then strategic investments in low-income neighborhoods or areas that have dilapidated conditions. And so as we think about the needs that have emerged related to COVID, you can certainly imagine things that fall into all of those categories. So now that the con plan has been submitted, along with our 1-year action plan, we can now start turning our attention to thinking about these new dollars and how we might utilize those dollars. Unfortunately, HUD still has not issued the notice that typically comes with any kind of new type of funding. And while this is within the sort of family of CDBG funds, it is a separate grant. So it's not just an addition to our existing CDBG grant. And there are some different requirements associated with it. And we're still waiting on HUD to issue that notice that should be coming in the next couple of weeks. We know that they're working on it. And that is important to have that information because it really does help you to determine what kinds of requirements are going to be necessary for the activities. But with that said, I think we can still start to kind of think about, well, what are the kinds of needs and start to map out a process. We still have to go through the same type of public participation process. They did reduce the public notice period from 30 days to 5 days, so that helps a little bit. But typically both jurisdictions work with their advisory committee, make a set of recommendations to their respective councils,
And then once that is determined, then submit a substantial amendment to HUD for their approval.
Stephanie, can I ask, because it's a NOFA, right, that you're waiting for? Is that
not a NOFA?
It's not a NOFA.
No, it is. So we're entitlement jurisdictions. So the amount of money is specified. And so HUD issues notices that essentially are telling us more about how do we determine eligibility for activities, which, when we submit, jurisdictions can submit their substantial amendments whenever they're ready to. But you have to be confident that what you're submitting is going to be within the eligibility requirements. And that's the information that we just don't have quite enough detail at this point in time.
Does the funding come to us, to the city of Eugene and to the city of Springfield, and then we wait for the notice? Or what's the, I'm probably asking a really silly question, but what's
these are good questions. These are good questions. So you essentially establish a plan with HUD for how you want to allocate the funds, and then you do the activity, and then HUD reimburses you. And so we don't get the money in advance. And it's all on reimbursement basis. There's a pretty complicated online system that we have to request reimbursement through. So there's a number of steps in the process.
Thank you. I kind of wondered if it was a reimbursement process.
Yeah.
Oh, that's great. Are there questions? Any other questions for Stephanie related to the CDBG funds? Lucy?
I would just make a comment that's sort of important to, and Stephanie can correct me as the expert on this, but in this chart that we have in front of us on the screen, it talks about it could be used for including expansion of community health facilities, child care facilities, food banks, and senior services. It's likely that the cities would look at a slightly different list of things, I would think, given that we don't operate community health facilities, for example. So the city might look a little more broadly about how they use these CDBG funds, just as a, give everyone perspective that not only is that money going to go fast, but there'll be a sort of a broader look about how it might be used.
Yeah, I would just say, can I just
go ahead?
Yes, go ahead.
So there's what CDBG can be used for writ large, but what HUD says is you need to use that money in ways that you've identified as priority needs through your consolidated planning process. So there's a very important linkage between those two things. Now, the areas that we've identified through our consolidated plan are fairly broad. There are a lot of different things that can fit within those. I think the other piece just to keep in mind is that you can use these dollars for capital. There are lots of regulatory pieces and requirements that go along with capital. So you have to think carefully about what's going to be the best path and use of those dollars. You can use it for human services, but again, everything has to be related in some way, shape, or form to COVID. And all we have at this moment is literally one sentence that says that. And the notice we're waiting on is going to give us a lot more detail on how to qualify those activities and also be aware of what the documentation and eligibility requirements are going to be, which is going to help us think about what is the best fit for these dollars versus the other dollars that are coming into the community. Go ahead, Steve.
Yeah, what I was going to say is I appreciate if you can work with Alex. I think this language that we have here was sort of the example language that that HUD put into like a one-page notice. And I think the main thing to get from this is it's you know, that they're really looking again at the healthcare or the economic or housing impacts caused by COVID-19 as the nexus for and then, you know, the overlay with that, like Stephanie's saying, is using your local plan to help guide you in that regard. But that's a good lead in to the next one, the Emergency Solutions Grant.
And Steve, we have about five more minutes, and then we have public comments.
I'm going to run quick then, and,
okay, thank you.
I won't take questions. I'll just run quick. But the 986,000 the ESG funds, they really are available for a range of things that include homeless prevention, rapid rehousing, prevention, housing counseling, and so a whole range of things that we can use that funding for. We're sort of in a similar status to the CDBG funding. We receive our funding through the state of Oregon. They have to submit a substantial amendment to HUD, and they've completed the portion on ESG, but the state, a part of that substantial amendment is the way the state's going to use their CDBG funds. There's $8.5 million of CDBG funds for balance of state, which includes in Lane County, the communities that are outside of Eugene and Springfield. So all the unincorporated area, and so we're still waiting to learn on CDBG from the state. This is the first of two allocations of emergency solution grants. So we'll probably see another allocation of approximately $1 million that will be allocated by HUD. So this total amount will be closer to $2 million based upon the initial federal legislation. You know, both the CDBG and the Emergency Solutions Grant, the legislation that the House passed last week would provide additional funding for both of these programs. And so we're going to have some time to spend this money. The Community Services Block Grant we get as an anti-poverty agency, and this money is very flexible in the way we allocate it. One example of how we're going to allocate it is the rental assistance funds come with no program delivery money to give to the nonprofits to hire staff. So we're going to end up probably using a portion of the Community Services Block Grant money to pay for those program expenses to get out the rent assistance. So that's just one example. You want to move on, Alex? The federal LIHEAP dollars, again, the low-income energy assistance program. The main difference here will be, again, the COVID criteria for people who are asking for assistance. They'll have to show, you know, either a COVID economic or health impact. And again, we're going to tie this in with the access for the waiting list through the county website. And then the actual eligibility determination is going to be made by, we work with the City of Eugene, the Campbell Senior Center, Willamette Lane for seniors, and then all those community service centers that I mentioned earlier that are throughout the county. We receive through Lane Workforce Partnership 2 different grants that total $390,000. One of them is to hire temporary workers for humanitarian assistance. So we're going to hire teams of homeless outreach workers to provide humanitarian assistance during this next fiscal year. And those will be teams of up here with a community service worker kind of setup. And we will be deploying the equivalent of 4 FTE at a time, and through the year there will be eight different people who are employed to provide those services. Also, what is happening is we're beginning to get on the front end some additional money from the federal government to work with people who are dislocated workers who've been impacted, who've lost their job as a result of COVID-19. And so additional FTE to work at the WorkSource Center to assist people with both career advising and training development and job development, and hopefully down the line, given the number of people who've been impacted, there'll be more money for that sort of thing to help people get back to work. So that's a little help. And then
Steve, we just have one more minute before we go to
the Emergency Food and Shelter Board met this week and allocated these additional COVID food and shelter funds to local nonprofits that put in applications. There was this $260,000 plus another $150,000 of regular emergency food and shelter funding that was allocated. We can get, I'll have staff send out to the PHB the list of awards to those nonprofits. So it's pretty broad. For example, one of the groups that hasn't really received funding in the emergency food and shelter program in the past is Relief Nursery. But they're providing a lot of assistance to families that they work with who have been impacted, and are doing outreach services to those families. And so that's just one example of something that's a little bit different in the COVID environment in terms of some agencies that aren't necessarily mainline basic needs agencies trying to take care of the families that they are responsible for. And somebody put a timer in front of me, so I'm going to stop.
Yes, I think it's, yes, thank you for that. I appreciate it. Well, thank you for the incredible updates. That's okay. That's I appreciate all the updates, all the staff, and all that was shared in terms of the resources. And I'll be anxious to see the list as well, because United Way has been supporting with small grants programs like Relief Nursery and others that are right on the front lines trying to help with rental assistance and food security support. So, this was a robust meeting, lots of data. Look forward to it. I know we'll be thinking and planning for the June meeting. Do we have anybody on the call here on the meeting who any public comment?
Yes, our first public comment is from Josh Caraco from Springfield Eugene Tenant Association. You have 3 minutes, and I'm going to unmute you now, Josh.
Thanks.
Can you hear me?
Josh, you're unmuted.
Yes, thank you. Okay, I'm Josh Caraco. I run the hotline at the Springfield Eugene Tenant Association, and I'm just here to inform you of some things going on and ask for your support. We are very worried about the state of our community. This body knows as well as any the huge amount of renters who are on the risk of ending up homeless before the COVID-19 crisis. And we're extremely worried what will happen to them when the governor's moratorium on evictions for non-payment of rent ends. And we have offered 5 high-impact solutions to the legislative solutions to the Board of County Commissioners. They're in a packet that Alex has included here. We know that that renters will need more assistance, but they will also need time and other protections. And we just are asking for your support and also input if you're willing on those issues. Because we know nobody knows more than this body the intense cost of homelessness on our current system, and the fact that we cannot afford an explosion in more homelessness. We know that our human services, our law enforcement, our court systems, our healthcare providers already spend an incredible amount of not only emotional and human costs, but also financial costs dealing with homeless individuals right now. and that we cannot afford to see an increase. And so we've offered some legislative solutions that can help mitigate and reduce in the future. We know that money alone will not solve this problem. And so I don't need to preach to you. You know more than anyone the intense cost of homelessness on our system and the intense need to do everything in our power to mitigate and help prevent future homelessness. And that's really all I have to say. And I encourage you to look at our recommendations and support us and give input if you'd like, and feel free to reach out. I yield the rest of my time.
Thank you, Josh. Alex, do we have another public comment?
The other attendee who had their hand up for public comment, I believe it's Richard Self. So Richard, I'm going to unmute you. And Richard, you're unmuted. I'm not sure if you're there.
Yes, okay. Here I am. Can you hear me, everybody? Okay.
Yes.
I hope so. All right, great. First of all, I appreciate all the think tank from both the city and the county being here to say I appreciate the rapid and expedient response to what the COVID pandemic. Something really quickly to be considered with the June 5th date of demobilizing the respite shelters to keep in mind was if they're dispersing everybody to everywhere around town may not be the best of ideas, as if there's an outbreak in the unhoused community, then the rest of the community, whatever we do as far as preventative measures, will be moot point. So I would consider that. As far as the rest of this, we need to really rethink what we're going to do in the future. I hear Commissioner Farr in this meeting saying things, and I know he is saying it trying to discourage the idea of there's a group of folks over at Washington Jefferson Park that EPD may disperse in the future. We really don't need to revert back to the old archaic decriminalization of the homeless people, especially if we're adding more possibly to the rolls in the future. There could be, as Commissioner Farr pointed out in the commissioners meeting, kids and families all of a sudden being homeless. We don't need the long arm of the law being stretched forth anymore to criminalize people. And lastly, I would have the county, city, and the folks consider, while we have failing infrastructure and a very big lack of jobs here, as maybe considering bringing back the Roosevelt doctrine of the Public Works Project to employ people, build our infrastructure and other things. Our homeless community is pretty talented, and our unhoused community could do a lot as far as helping this community in and of itself. I'll yield my time. Thank you.
Thank you, Richard. Is there anything else for the good of the order? Again, thank you to the county staff for all of the reports, and appreciate everybody being here. Take good care, and we'll see you again soon. Thank you.
Thank you so much. Thank you.
Thank you.